You know, I just want to ask something related to the headache, the one that I see every day. Okay. What is the effect in, you know, in our daily the sleep pattern, you know, related to headache? How can we prevent that? How can we help ourselves?
Okay, so
And does electronics that cause headache, the one that, you know, I hold my phone all day long and all of these kind of things?
actually, I had done this last time. Okay, so I find it very useful, and my even documentations here and all patients I'm seeing here. I start with lifestyle advice, and I had already last time shared, and people can access to this also. That 5 lifestyles include adequate hydration. Children are not drinking enough, and we have guidelines here how much water to drink, age specific. Number 2, hygiene. There is age specific sleep requirement. All of us are not sleeping enough, and Dr. Dalal is only sleeping 4 hours, so we have to do something. Okay, and very important in triggering and bringing, precipitating these headaches, very important. Then screen time, under 2 years, 0 hours, after 2 years, 2 hours. None of us is adhering to that. So I fully agree with you. A lifestyle dysfunctioning is definitely contributing to at least triggering these headaches. I hope it answers your question.
One more question for children when they don't go to school and they don't eat breakfast,
Okay.
you know, from their home. We always push them to, does that cause headache? You know, if you don't eat the breakfast in the morning, should I scare my child that if you don't eat the breakfast, you're going to get headache?
Okay, so again, I have mentioned it is in one of my five lifestyle factors, meal regularity. And you are very right that recently I have seen a couple of children who actually had dizziness episodes at school and also have some kind of headaches also. And when we looked into the history, they were not taking their breakfast. And so it's very important that all these things, especially when children are in a growing age, their needs are quite high, both water requirements and calorie requirements. So regular meals is very, very important. At the same time, junk food should be discouraged. Although one off in a week or a month, that's fine. But it should not be a regular practice, because in addition to other risk factors, it is also leading to obesity epidemic, which is also on the rise here. So I think you are very right. Working on meal regularity is an important part of advice in a general day-to-day care practice, also in headaches, which I regularly do.
Dr. Rashid, I have another question.
Yes.
Is there any correlation between the learning difficulties and headache?
Is there any
relation between learning difficulty and headache?
See, okay, so we have seen that conditions such as associated with hyperlaxity of joints and all those, they have a very high association with the migraine type of headaches and POTS also, postural orthostatic tachycardia syndrome. Learning difficulties, again, it can be, learning difficulties would also affect all the lifestyle factors. Then they will be requiring more effort and exerting more, probably that can contribute. But as a causal relationship, I'm not aware of any. If anyone else knows it.
I've commonly seen, like over the last few weeks, I have many cases presented by learning difficulty and there was a relation with a headache. I don't know what's the relation, but one of the complaint was a headache. So I think it's related to somehow.
No, that's what I'm saying. It could be related because of association rather than a causation. So because they need a lot of effort in every area. When they exert, their sleep may be affected, their hydration may not be good, their meals may not. So all those factors might be contributing, but that could be an association relationship rather than a causation relationship.
Okay, thank you.
Thank you, Dr. Rashid. With you, Dr. Dean from KidsHeart. I am a clinical psychologist. Thank you for this excellent and great presentation and this variety cases. Actually, I have a question concerning headache and its relation with neurodevelopmental disorders, also especially autism spectrum disorder, because many of autism spectrum, they suffering from sometimes from headache, and another patient also in adolescent also may suffering from kind of headache, especially in frontal or forehead part. And they also, the family reported that this headache prevents them to sleep at night. So is there any results according to this?
Yeah, okay. So your question is two parts. First is neurodevelopmental conditions or disorders such as autism spectrum disorder and association with headaches. Yes, you are very right. You know, if you look at non-autism spectrum comorbidities in autism spectrum disorder children, this is a huge list. They have sleep difficulties, which is very difficult to treat in those. They have behavioral problems. And similarly, as I told you, again, this comorbidity, again, it could be more of an association rather than a causation relationship here. But I agree with you that children with the autism spectrum disorder, they have a very high comorbidity burden. And one of the factors which we mentioned earlier from the lifestyle is sleep. So the sleep is really haywire. And that could be a contributor, because if you have a less than required sleep, or even if you have an adequate number of hours, but it is a disturbed sleep, in the morning you get up with three things. One is irritability in behavior, number two is headaches, and number three is poor concentration. And that is why in children, when we are assessing for ADHD, we generally start with history of asking any obstructive sleep apneas or disturbed sleep or snoring or adenoids, because if you get a disturbed sleep and it is less effective or efficient sleep in the morning, you will get a poor concentration, irritability in behavior, and then headaches also. So this is how it will explain. Coming to the teenagers, a very, very common association. And you know that after 12 years of age, as I mentioned, the girls outnumber boys. And when we look into various factors, it could be hormones, it could be their lifestyle, and now they are discovering their new type of independence. It can be relevant to areas, and they start sleeping overs, they start trying many things, including smoking and other things also. And so that's a sudden lifestyle change, and then that hormonal factors, all those contribute. I'll just give you two examples. Before I was coming from Liverpool this time, so I saw two girls in a span of about three, four months. And both of them had few things common. One, they were preparing for the GCS, and they were finding it very overwhelming. And they also had a recent change of their one of their friends leaving that school and going to another school. So both those factors were triggers, and they ended up having, actually they started with episodic headaches. After a few months, these became chronic headaches, and they stopped going to school, and they were bedridden, and that led to deconditioning of their bodies, and they were even not able to stand and walk around. And that was a very difficult scenario to treat, because we involved our audiovascular team because they had balance difficulties. We involved our clinical psychology team. They didn't want to go to school. And one of the things as a part of headache advice is that never advise holiday from school. They should be always asked to go to school. No holiday is a treatment for headaches. So I agree with you. So it's one as a comorbidity, a part of the first question, and second that it's again, I think a lot to do with lifestyle and how teenagers and young adolescent people cope with their stresses.
I'm sorry, doctor, last question, if you allow to me. Concerning neurocognitive disorders such as Alzheimer or dementia, it can be headache one of the signs of early Alzheimer or early dementia disease?
Okay, because I'm a pediatrician, so Alzheimer is out of my scope. So I probably am not qualified to comment on that. So I'll leave this question for any adult neurologist sitting there, please.
Okay, thank you. Thank you so much.
You're welcome.
There was a question, Dr. Rashid, from the audience asking for, can we prescribe medicine for teenagers in school? They are complaining about headache before sending them to the pediatrician.
Okay, so what we advise is actually that first we write to school nurse that a child should not be sent home. This is very important. Number two, we tell them that if, for example, noise in the class or some visual disturbance in the class trigger a headache, we ask them that if you can allow the child while at school to be in a quiet place, and if needed, a dark place for about 15-20 minutes, and that can be helpful. Now, if they give pain medication, because nurses may not be fully aware of medication overuse headaches, if simple analgesics are used for more than 10 days a month, for more than 3 months, and headaches keep worsening, and this suggests that probably there is a medication overuse headaches. So we should caution them that paracetamol every time he comes to you. So I was telling is that if the nurse should not function as a pediatrician or a neurologist, so when things are beyond her scope, she should refer to a pediatrician with special interest in headaches or a neurologist.
Yeah, there was a question how to differentiate between physical headache against psychological headache. A quick tip, kind of.
A physical headache from
psychological headache, or tension headache, or whatever you want to call it.
Okay, right. Now, as we mentioned, we have to go by international classification of headache disorders, society guidelines, which is a beta version available. So we have to differentiate between primary and secondary headaches, and we should see that whether they fall in migraine, tension type headache, or that if you mean psychological factors can affect any of these headaches. They can make them worse. Okay, but then if you talk of tension type headache does not necessarily mean psychological stress, tension. It can be multiple factors. It can be the way we sit. It can be our postures. It may be because of the pillows we use. It may be because of the mattresses we use. So multiple factors. But one of the striking features is that tension type headache is never unilateral, number one. Number two, it should be squeezing and tightening in character. Then there is a very important sign called pericranial tenderness. When you use your pulse of the fingers and check on the scalp, any tenderness, any sore points favor tension type headaches. There is a criteria we have to meet, and there should be no nausea and vomiting, and there should be only one of either phonophobia or photophobia. And then we differentiate into and categorize into episodic tension type headaches or chronic tension type headaches. There is a criteria. Then there is an infrequent tension type headaches and frequent. So that is a separate. But as far as psychological factors are concerned, psychological factors can aggravate any type of headaches. But if your question was that is this a functional neurological disorder, there is no diagnostic test on earth to say that if a child thinks I have headache, you can deny it. You can't deny it. So because it's a subjective experience. So headache, however, the tools we use to classify or ask about the severity and grading of the headache is you can use that face scale and different or numbers like 0 to 10, whichever way. But the limitation, the problem with the headache is that it's a subjective experience. There is no objective sign to say that headache is there or not. If somebody says I have headache, I have no tool to say he doesn't have headache.
So I think also add one thing. We should rule all the physical causes or the medical causes by exclusion.
Yeah.
If all the causes excluded, so still we have only ended by psychological headache.
Thank you very much. Thank you very much to both of you. There was a question that I wanted to ask, but I don't know if you have a magic answer to it, which is determined a cause of a headache for human being or no?
What is the question? What was that?
Married, a cause of a headache or it's less headache after you get married? Which one?
I cannot answer this.
Anyway, thank you guys. Thank you to everyone.
Sulaiman, your wife, she's the only one can answer this question.
Well, I have so many sources for the headache. I don't know which one is which. All right.
Thank you very much for your patient listening and giving us the opportunity to speak. Thank you.